Yeah, thank you very much, and welcome also from my side. I was thinking hard how to connect the topic of sperm analysis with infrastructure and resilience. Um, I couldn't really find a plausible connect. Maybe you have some fantasy and you find some also during my presentation, which will be about the transformation of healthcare systems globally that we are observing. And why that is so important, because healthcare is critical infrastructure. Due to the, let's say, geopolitical tensions that we are all aware of, we now need to rethink and think differently of healthcare compared to how we thought about it maybe 10 years ago. Plus, of course, there is now so many new digital tools on hand that could enhance not only the patient care, but also the hospital operations. Now, let's look a little bit deeper into the building blocks in healthcare that need to be resilient. And this is really a broad picture, like flying over a hospital, not looking into a patient, but into an ecosystem. We look into a campus, and that is something people oftentimes forget. When we are talking about healthcare, people think about diseases. Yes, absolutely right. But there is also buildings where people go to have these diseases cured. And oftentimes those buildings are in really desolate situations. So we do have customers in Europe where they could not open their operating rooms because the ceiling is either leaking or crumbling into the operating field. I've visited one of my customers and was talking about digital twins, and he was looking at me and like, Janina, let's get real. I don't even have Wi-Fi on-prem that I could really use. We do it still paper-based. So providing really resilient infrastructure means we also need to look into real estate. How can we build a building that is resilient and that is also easy to repurposed? Let's look into Ukraine, let's look into Iran. How could we really change then from an operating room into a garage or an ICU in a garage if we have drones or bomb attacks? This repurposing is super important in the future. The same is true, not thinking only about critical situations like war, but we all do know we have an aging population. We have this demographic shift. We do know that there will be more and more patients in need. So what we have also done, for instance, in a hospital in Switzerland, we have built the hospital today for tomorrow, meaning you have patient rooms now, which are single rooms, but you need to think of all the wiring, the cables, what have you, to make it possible to extend, not only have one patient in that room, but have a room that is easily refittable for 3 to 4 patients in the future. And that is important to keep a hospital operational. Furthermore, then we come to the clinical operations. I mean, this is a broad field and probably a little bit more of what you have been thinking about. Clinical and hospital operations is interwoven very closely. If you think about diagnostics, if you think about operating rooms, if you think about patient journeys, patient experiences, how does a patient experience his or her stay in a hospital? And that is something we will look into on the next slide, because there's definitely more to it. First of all, we look into how can we build resilient energy. Maybe you think, why? First of all, let's start with the patient. Do you want to freeze in your bed in a hospital? You need heating. You need clean water. You need air conditioning, especially in an operating room. Super important. Some of you might know you need overpressure. You need to change the air continuously. So here, this is a super energy intense process. Maybe to give you an example that you get a better feeling of how much energy a hospital is consuming. If we look into one hospital, roughly 300 beds, what do you guesstimate? How many four-person households for a 300 hospital, 300 bed hospital? Any wild guesses? What would it equal to? 1,000. So a 300 bed hospital is, I would say, the average size of a hospital, not that big, and it equals to around about 1,000 four-person households, meaning that one hospital bed is, depending on how energy efficient you are, about 3 to 5 family households. That gives you a little bit of an idea why it's so important that you have not only energy efficient buildings, but also resilience in energy. We've just seen that in Berlin, what happens if we are running out of energy, and there were hospitals affected. So thanks God, of course, you have aggregates that could stay, generate energy, yet you need kerosene for it, and it only takes you over the next 48 hours. So what if you have longer blackouts? What if? Yeah? Very important if it comes to building resilience in healthcare and critical infrastructures. The second one, safety and security, super broad field. I could imagine what comes first to your mind is cybersecurity. We hear a lot about it here. And maybe also some facts. Healthcare industry, believe it or not, is the most hacked industry globally. Health data, but also scientific data, is really, really something people are paying a lot for. You probably have heard steal now, harvest later, because we have just that many information, that many data that they have at us now and could not read it out or not use it. But you also get kind of interesting constellations if you have VIP people and their medical records get stolen. So, of course, they do not want the public, the broader public, to get their really intimate personal healthcare data. And they are willing to pay a lot to get the data back and not published. So that is something, of course, we also need to think about. How could we make healthcare data, our real personal data, safe? On the other hand side, how can we share data for research? European health data space is one example, and hopefully also a safe place that we could then build on this data pool and develop precision medicine and individualized therapies. I don't want to jump to the next. I want again to have you or to share with you another anecdote from a customer of mine if it comes to safety. Maybe also something you probably do not immediately think about. But he is a really cool guy and he told me, okay, let's have a bet. I bet that you can get from the entrance of my hospital, huge university clinic, into my OR without even being asked a question. I said, okay, bet is on. I didn't wear any Cossacks or anything. I wore normal clothes, white jeans, t-shirt. Nobody stopped me from the hospital entrance to get into the operating rooms. I thought that was a joke. It was shocking if you really see how easy it is to get into this critical infrastructure. If I could get there, pretty much everyone could get there. Another example, and we read in the news about it, is that also on the pediatric stations or wards, people hide in the toilets and they harass little children because it's open to everyone. You can just go there. So also here, how can we make the hospital where you want to get healthy also a safe place? If we talk about safety, there is one more important topic that is also very dear to my heart. What we observe now also here in Europe more and more is aggression against healthcare professionals. Pretty sure you have heard about that or seen that on TV, but nowadays you get attacked as a nurse, as a caregiver, as a surgeon by your patients or by visitors of your patients. There is a lot, you wouldn't believe it, but there is a lot of police in the hospital. There's private security nowadays in the hospital. And in really critical areas where hospitals are also located, healthcare professionals, they have the body cams. You might know them from the police and from the American TV. This is nowadays becoming a reality for healthcare professionals. So also here we need to think about safety and security, maybe in really different ways compared to how we have done so just a couple of years ago. Operational efficiency, I think we've already touched it a lot. Yeah? How to keep a hospital operational. You need fire safety, you need water, you need electricity, you need all the data from the sensors that are in the ceiling compiled in one, most times it's called a cockpit or something, that you could regulate what is happening. And that you could also look into energy spikes. How could you reduce energy consumption? Meaning you need to measure, of course, where are you losing and where do you have a lot of spikes in energy. Public hospitals, oftentimes, they have light in every room, even there is no patient. They have heat in every room, even there is no patient or nobody. So it's small things, but think of a hospital environment. There is also a lot of opportunities to reduce your energy consumption and to be more mindful if it comes to how can we run more efficiently a hospital. The other thing, obviously, and here, and by the way, of course, this is all AI supported. It's super interesting if you have all the sensors. You can do real-time location service. Probably you have visited a hospital. I hope you were not all patients there, but you could see that people don't find their ways. Oftentimes it's super confusing to get from A to B to C, how to get from one ward to another ward, and then you have a CT scan and you need to get there. So you could have also on-site navigation on an app on your mobile phone, which really helps tremendously to find your way around. But also it helps healthcare professionals to find stuff. Sheer statistically, what do you think? A nurse, how many minutes per shift is she looking for something? Not taking care of the patient, but looking for something. 23 minutes. 23 minutes in one shift. Much more. 72 minutes. So just think of a nurse, a caregiver per shift looking 72 minutes for something and not doing the job. We have done some pilots where we have tracked wheelchairs, infusion pumps, beds, whatever is legally allowed to track, and to hand it to the nurses. And we are running these analyses still, but we could show that we could reduce just the time for search more than half, which is already a lot, because if it comes to nurses, the time scales. Yeah? It's many, many nurses in a hospital. The other thing is, if you track your wheelchairs, infusion pumps, etc., you could also use this then for preventive maintenance. You know when some wheelchair is missing, you know when some wheelchair is defect and you need to repair it. You can also use it for your financial planning. When do you need to buy new infusion pumps? Because you know it's that old and we need X, Y, Z. So you have it also in your Excel sheets as a paper. This is interesting as well, not only for the care department, it's also interesting for the CFOs of hospitals, because it saves a lot of time and a lot of money. I see Zeynep already nodding and smiling. We have had this discussion earlier, exactly. So last but not least, because I believe one of the most personal things in life is healthcare. Most of us have started our lives in a hospital, and probably most of us, we will end our lives there. So it's also about the patient and staff experience. I do believe if you are in distress, if you are in a hospital, your mood is probably not the best. So you're really grateful if you have people who are taking care of you and not of the equipment, who are there when you need them. And also if you are in charge. So what is super important here psychologically also is you lie in bed, but you can control the room temperature, the light. You can decide what kind of meal you want to order. You can decide what kind of papers you want to read. You can decide what kind of TV you want to watch. All this with a click on a mobile app. And that app you could configure already at home. You can take it also to your next visit in the next hospital, etc., etc. That is when we have interviewed patients is oftentimes underestimated, that they do not feel helpless, but these small things, that they are in charge, that they are in control, that you do not have the feeling that you depend 120% on other people. So it's really also the small things, not just the big ecosystems and the campuses, when we are talking about building resilient healthcare structures. And with that, I would like to close my little impulse, and I hope I could inspire you thinking a little bit differently about healthcare and the different topics in the future. Thank you so much.